Today we're doing a video on back pain treatment. So I want to show you how I treat a person with back pain. I have a patient who's willing to be filmed. So come with me to the treatment room and we'll see which point sites we choose. Hi Joe, how are you feeling today?
Very good.
How's your day been so far today?
It's been pretty relaxed.
Okay, good. Now I treated you a couple days ago, your first treatment for your back pain. How have you been since I treated you?
I am sleeping a lot better. The lower back pain's going away.
Okay, good. Now your back pain is, if I remember correctly, your back pain was caused by sports activities and working out. Is that about what you think the cause was?
Correct.
I'm going to look at your tongue, and we're going to look a little bit of what's going on inside your body that's causing the back pain, besides what we think is the reason, which is your activity. Let me see your tongue. Okay, that's looking great. Here, let me show you what I'm looking at. Look at the mirror. Now put your tongue out. Okay, so you've got a good coating, you've got a good body color, you've got a little edging there, and if you put it out a little more, you'll see that it gets red on the tip there. You're basically very healthy, and you will respond very quickly to the acupuncture treatments. So the fact that you've already improved from one treatment is commensurate with what I'm saying, and I think that it'll only be a few treatments we'll be able to do a huge amount of clearing for you. I'm going to check your pulses, which is there's like 1, 2, 3 positions here, superficially and deep on your artery, and the same thing here, 1, 2, 3, superficial and deep. And as I check these, I'm going to be checking the meridian pathways that I'm going to be treating, especially there's one that I'm going to be interested in clearing for your back pain. But I just want to see, in addition to your tongue diagnosis, I want to look at also what your pulse energy distribution is like in these pathways. And they are ones that cover the torso, front and back, internally, and then also more peripherally the limbs and how your tendomuscular system is being supplied. And I think, because I think you're very healthy, I think it's going to be in pretty good shape. So we're just double checking that really quickly. And yeah, there's a little bit of a blockage there, but that's what we expect when there is a little bit of pain. Can I have you lie down, face down? Now we'll do a treatment. You ready for that?
I'm ready.
Okay. I'm using sterile, disposable, prepackaged needles, and they're one-time use, and they're the thinnest and the shortest needles that are on the market. So I don't needle deeply. I'm very gentle, as you remember, and they really don't hurt that much. So do you remember that they hurt very much when I was treating you?
Oh no,
Okay.
not at all.
So let's try another treatment here. I'm going to start at the top and do a couple of the points heading down this particular meridian, because his lower back pain has to clear up and out. The problems, when they get severe, will radiate down the nerve, so even lower back pain can produce a sciatica pain down the legs. But what I'm going to do here is clear it more superficially up and out. So the upper part of the back is where some of the energy releases that's in this tension that he's got in his muscles here. So it's just, common that people who do sports and work out kind of get a little bit tight, and even though they do think they hydrate enough or they stretch enough, sometimes they don't quite hydrate enough. You see that over the kidneys, or their body just stays a little bit tighter than it should. So these blockages here are really or even up here, are what's causing the lower back to not be able to clear. So we're going to be doing some work on the upper part here. Here's the first treatment's going to be around this point here. Are you ready?
Mm-hmm.
Okay, very gently, I'm just going to place the needle like that. Okay, how was that? That didn't hurt?
No, it's good.
Okay, and then I'm going to put another needle right here, and this is just for the upper back to clear some of this tensive energy up and out. More deeply, the pathway will service skeletal bone structure maintenance and nerve tissue maintenance, so the deeper aspect of the pathway maintains tissue structure. But the more superficial aspect of the same pathway releases energy and releases the tension out. So we're needling superficially, and we're asking the superficial aspect of the meridian to be doing its clearing work. And that will benefit the lower back as that energy rises up and out the whole way. So we're just going to do a couple point sites here, as we can see where he has some extra tension, to clear that. There's reasons for tension up here. It can be that he's working hard and being. Are you working every day? Are you fairly focused at your work?
Yeah, every day.
Is there some stress at work?
A little bit.
Yeah, because that's pretty common, and that kind of activity can keep. A lot of people hold their stress at the top of the body. So if you were to dig in here, you would find that there are some muscle knots and very common tension areas. That initial blockage can cause secondary and tertiary blockages of energy. So the lower back pain seems like it's being caused at the lower back, but it turns out that the whole back is involved, and the clearing of the upper part is what's really needed. So if I only did the upper points, he would still get benefit at the lower back. But I'm going to run down and do a little clearing down. We're going to check out over the adrenals and the kidneys here to make sure he's not too dehydrated. And this is, I have a feeling that you really do drink 4 or 5 bottles of water a day. Is that true?
Yeah, about that.
You're pretty careful about that because it's really looking really nice, and I can say almost gushy. His muscles are fairly soft here, which means he is well hydrated. And that's important for all conditions need proper hydration. So we always look for how well hydrated is a person. Then we come down into the lower back area and we'll do a couple of point sites down where he really does have his pain. Is it hurting a little bit down into the legs, or is it staying in the lower back?
It's mostly in the back.
Mostly in the back part. Okay, so we'll focus on that. Do just a little bit extra right here at this sacroiliac joint. This is the SI joint here, the sacroiliac joint. And these muscles always tend to be a little bit tight, and they'll chafe on the nerves a little bit is what causes the discomfort. So what we want to do is release the tension in the soft tissue, which is tendons, muscles, connective tissue, so you don't get a herniation of the discs. If you have a scrunching going on with the vertebrae and the soft tissue is scrunching, then you can herniate the disc, or at least chafe the nerves that are coming out that then go down the legs. So the lower back nerves, they're going to the short nerves go to the local area, but the deeper nerves in the bundle run down the leg. So if your situation gets more and more severe, then the pain might go down your leg. And that's always something that I always want to know, is how far down the leg does the pain go, or is it just local, and how severe is it? So most of the discomfort that's in the lower back, even to the front, to the groin, or down the legs, is coming from the lower back area. So we don't have to treat any point sites that are going down the leg today. We're just going to treat the lower back and help that contractive energetic clear up and out. So it's contractive tightening or releasing and heading up and out. So that's the yin-yang principle that we're working with here, is that the yang is an up and out functioning, and the yin is in and down, becoming molecular structure and form. So we want to help release that. So we're going to leave this alone we're just going to let you lie quiet. Are you comfortable now?
Yeah.
Okay, so this wasn't too painful. And then about 15 minutes, I think we'll leave these needles in for you today, because it's only your second treatment. So it'll be a little bit short, and I did more needles today than I did last time, but that's because I think that you can handle it. You seem comfortable with it. There was no flinching, which is a good sign. So you'll probably clear very quickly for your lower back pain. I anticipate only a few treatments. And so we'll see. So I'll come back in a little bit and take the needles out. So Joe, can I wake you up?
Oh, yes.
Okay, so good, because I know you tend to get a little bit relaxed. Were you falling asleep?
A little bit.
Yeah, the endorphin release in the brain is part of what gives you that relaxation. Plus lying down, of course, is very nice. Now I'm going to gently take the needles out and close the point sites a little bit with my finger here. Just close the point sites gently, just to indicate that we want them to be closed now, not be open releasing anymore. And then what I want you to do is do 3 showers per day, just to help clear the energy. The electrical charge will discharge to the wetness. So take 3 showers a day if you have time, to help clear more of your tension. Okay, so that's something you can do besides just drinking water. You can use a shower as well. So the water is your friend internally as well as externally. So that'll be how you're doing. So now when you're ready, you can get up, and then we'll talk some more. Thank you, Jeff.